Hey guys, welcome back. Lesson 19. We are on the downhill slope. We got 5 left after this one. 5 left after this one. Well, let's see, 19, 21, 2, 3. Nope, we got 4 left after this one. So anyway, so what we're working on today is I brought my last client back from the last video. Now, if you remember on the last one, he was having some knee problems. So what we did is we really stripped the quadricep out. We came down here a little bit into that the peroneals and the anterior tibialis muscle. And now what I'm doing is the reason why I'm bringing him back is because as I was talking to him and saying, hey, you know, I was really educating him on what needs to happen. And so now as he's coming back, now he's got some calf issues showing up on the opposite leg, so it's going to be on the right leg. We worked on his left quad last time, and now we're working on the right calf and hamstring. So we're going to get the calf muscle, we're going to show that, and then we're going to go up, and he says he hasn't had a lot of hamstring issues, just more calf and into the lower hamstring, but in my head I know that if he's got calf problems and they're a little bit into the lower hamstring, he's going to have some upper hamstring, mid hamstring, and then we're going to check the glutes just to make sure that those are good, nice and even and everything. So I know I've stressed this all the time with classes, seminars. When you guys were talking individually, make sure that you're educating your client on how their bodies can shift. And make sure with whatever you can do is try and get them back in here so that you can get their whole body situated. Education and education is the key, really. And just to talk to them, communicate, and make sure that they're understanding their own needs about their body. And you've got to be more excited about their health than they are. Okay, really that's the key, is you've got to educate them and be more passionate and more concerned about their health than they are. Because unless it really is bothering them, unless they're like, holy cow, I can't move or do anything, they're really not as concerned about their health as they should be, and as their muscle structure. So educate, communicate, and what was the other one? Educate, communicate, and then just get them back in. That's really what you need to do. Educate, communicate, and get them back in. Reschedule. That's educate, communicate, and reschedule them. So yeah, that's what we're going to do today. I'm going to show you the bolsters, just how I would do it. So I've already talked to him. I already kind of know what's going on, what he's been doing lifting. We just know that he got done with squats, did a lot of jump rope, and so the left knee is fine, and now it's the calf. And that's what we're going to do. We're going to check the calf, the hamstring, and the glutes. Okay, here we go. So the first thing, I'm going to check that calf out. And it is as hard as a rock. So when I kind of do that, I like to check the other side just to feel. And you guys can see the difference. That calf, that's loose, that's nice. But what's happening is as you push on it, see, that one is kind of squishing, and this one is just rock solid right in through here. So this is the first place that I'm going to start. And I got my bolster. And what I'm going to do is actually put it underneath his foot. And I'm going to kind of move it a little bit so it kind of points his toe a little bit more. It's going to give a little bit more slack on that calf muscle. And the knot is right in here, but I'm going to start a little bit above it and kind of work my way down. So I'm just kind of seeing where it's at, excuse me. I didn't even eat breakfast today, so that's why burping and stuff. There we go. Yeah, okay, so it's right there. Just kind of moving around. And the thing is you find a knot, one of the greatest things that I can emphasize too is you just got to be patient with it. You got to be patient with it. There it is. Okay. So what that just did is that just rolled me right onto it. make sure that you can get yourself into a position. Notice I came this way. I couldn't get the angle that I wanted, so I left the pressure on it, but I came up here, and now I'm pushing down to see if I can get that to relax. Okay, now that, I'm just going to show you guys, this just spasmed right here and let go. Okay, good. Now we found it. And now we've got some twitching going on in through here. There we go. Okay. Feel that kind of tension ease off, Chad, right there. Not as much pressure. Okay, so I know the knot's here. If I go directly on this knot, it's going to really hurt, especially in the calf. So that's the reason why I came up here first. I'm loosening that one up. And now, okay, good. Yeah, we got some squishiness out of that. So now I'm going to actually go onto that calf muscle itself. Now I'm hitting the soleus and kind of the peroneals. So the other thing that you could also do is you could put a towel underneath its quads and really turn it out. So that way you could twist the leg, allowing the calf to fall a little bit, which is going to help you get into the crease of the soleus a little bit more. The farther it is on the outside, the more you can do this. It's going to take the tension off the knee because you've turned their foot. Now, if it's really more on the side, and you really need to bring the leg up into this position, then you can. But right now I'm focused on that calf, and so all I needed a little bit was to get that muscle to just fall off to let me in. I'm actually going to, I got to reset him. Okay, good. Now on this one, because it's a little awkward, I'm actually going to use my elbow, which is right there. Taking that calf, that foot, I'm bringing it up, pointing it down. Now on this, it could be a lot easier to use the elbow, because when you start getting it, there we go. I was going to say, when you start getting into this, these muscles like to flip really good. So we just separated the peroneals from the soleus and the calf. So now I'm going to take this back out. I'm going to go straight, and now I'm going to come down on the knot that I felt at the very beginning. And I'm just kind of using that heel to move that around. There's the knot. Yeah. See, now he's taking some deep breaths. That one just kicked me out. Sometimes it'll do it, but you just got to be a little patient. Just maintain that pressure. There we go, little movements. It just spasmed right in there. And you guys can go back and rewind this and see where all these are jumping. There we go. That just separated. So we got little movement. Now that that's happened, I'm coming back out because there's where the knot is. And now you can see that he's getting it. So I started up here because this was tight. This let go pretty quick. I turned him over. We loosened this. This let go pretty quick. I found the knot, a big old knot here, and that kind of released really quick, and it just kept dropping me in to where it was right there. So I started here, and within an inch is where the real knot was actually taking place. This is where I was feeling it, but this is where it really was taking place, was right in here. You got to be patient. You can't, that's the thing, is it's very patient, very consistent pressure, slow movement, because if you do too many movements, the body's going to react. Just moving that heel back and forth. He's doing a good job. Good. Breathe. Breathe in. Open your jaw. Just relax that jaw. There it goes. There. Now hopefully you guys saw that, but there was a twitch. His whole leg just went bloop, and then it just relaxed. So how's that pressure, Chad? It went from probably what, an 8-9 to about a, 3-2. Yeah, just like that. And now, that's a lot squishier. Okay, so what's happening is I know I want to work on his hamstrings, but with the calf muscle that tight, I want to make sure that we don't have anything knotted up down here on the deep calf muscles that could affect possibly any plantar fasciitis or foot problems. So, and how I love to do that is I like to turn them inside so that calf comes outside. And then I just kind of see, so here on the inside, the outside, not bad, but on that inside, there's a really good knot. So what I'm doing with this foot, now there's a couple of things. You can bring that foot up here like this, and I'm going to show you that. And you can really kind of move it around. Let me flatten it out so you guys can see, like that. Okay, notice how I'm pushing that foot in a dorsal flexion and then plantar flexion, dorsal, plantar. You can also kind of rotate it around if you can't quite get a good feel for it. Okay, so that's where he doesn't like it. So moving it in a dorsal plantar motion, it was fine. But to go from inside to outside, there it goes. It didn't like that. So that kind of tells me right there on that motion that there's been some sort of sprained ankle with this, which I know his background is sports, and there's been lots of injuries. So makes perfect sense. Okay, so now I like to check both sides. Feels fantastic. Now what's really cool is before I couldn't really feel anything with this. It was really nice. As we started loosening this up, and this feels really a lot looser, I went over and grabbed this side, and I can feel a lot more tension now on his left calf. So what I'm going to do is be like, okay, there's going to be some stuff over here. How much time I can get, we really want to make sure that this side is fixed. If I have time, I'm going to go down and do the other calf. If I don't, I know in my head, that's how I'm going to educate them. So when they stand up, they're like, holy cow, that feels really good. You can be like, okay, what we need to do is we need to get you back in, because what I didn't have time for and I felt was your left calf was really tight. And there were some knots in that calf. Now what I don't want to happen is for you to go a longer period of time and have that left calf tighten up on you. So let's reschedule you 7 to 10 days. Let's get you back in here. Make sure that nothing else tighten up on the right side, okay? Make sure that everything feels good on the right side. We'll make sure we check the left knee and the quad, which we did last time. And then we'll go down and we'll make sure that all those muscles in the calves are good. And if they're good, then we can work on the glutes, the back, and maybe other things that you might have ailments to, okay? Did you guys see how I just did that? I'm taking a mental shot of, okay, we've got calf problems, we got this. You know, if he's got calf problems, I know he works out and he's had injuries, he's probably going to have shoulders. You know, you just got to notice, you got to ask certain questions for him, okay? Just up here, he's got some white mark on his thing, and I was like, well, what'd you do? Did you put tape on there or something? He goes, oh no, I squatted this morning. Bam, so in there instantly, I already know what's going on in his life. He likes to work out, wants to maintain health. So you can use that to help you help them get rescheduled and get in here, okay? All right, so we did that. Now we're going to go to the hamstring. So this is how my brain works, okay? So we're going to go, and I'm just going to put him on that bolster because I know he's going to have quad and hamstring issues. And all I'm doing is I'm just putting pressure on. So right here, we got a knot. Right here, we got a knot. It's okay to take 30 seconds to a minute if you just can't find it, and just kind of feel around, okay? The client is more interested in you getting the knot and feeling better than if you take 30 seconds, a minute, something like that. There's been times that I'll find something and I'll be like, hold on just a minute, and I'll go over to my chart and I'll be like, okay. And inside I'm thinking, all right, we just worked the calves. Okay, we got hamstring. He was tight on the inside, so it could be the semimembranosus. But he's also tight on the outside, so we've got some bicep femoris stuff in there, which would make sense because of how tight the upper one was. And then I go, okay, I come back, and then I can explain it to them. They're okay with you taking a little break if you educate them and communicate with them. Some of the greatest things that I've had, that people come in, and that's the two things that they've really appreciated with what I do. That's what's brought them back, is because I communicate with them. If I have to stop, be like, hey, you know what? I got to check my chart out. Let me just make sure what I'm thinking, what I'm feeling are the same thing. And the majority of them, they just laugh and be like, oh, good, I get a break. Yeah, take all the time you need. So, but then when I come back, then I can educate them and be like, all right, so what we got here is you've got the short head, what's called the short head of the bicep femoris, and the long head of the bicep femoris. There we go. Hopefully, I think this camera is going to be the best angle for that one. Hopefully you guys just saw that whole thing. Did you feel that, Chad? I just busted loose. That whole thing just absolutely separated. So rewind it and watch his leg. When I brought it up, it went bloop, and it just clicked. And when I brought it down, the whole thing separated. It all just shook. Okay? Now the reason why I did that is I made sure, I went, okay, that's where I think it is. That's what's going on here. I've got the bolster underneath him for the optimal level. And it went really quick. So now he's got one more. Now it's on the inside. This is going to be the semitendinosus. And he said at the beginning, he goes, oh, I really don't have any problems with my hamstrings because I stretch them a lot. But because of the tension in the calf, we know we're going to have some of the hamstring issues. Just because people don't feel it, there we go. Doesn't mean that they don't have it. All right. So how you work on the inside, I've taught you before. I would stand on the other side, and I would come at it like this, because it's kind of hard to do this angle. It's kind of, you can be difficult. You can roll them and then move that to get to the inside one. But really, the best thing to do would for me to go on the opposite side of the table and get the inside one just like this with the movement of the hamstring. Okay, but we're not going to worry about that. So this, and this one were the really, really big ones that are going to cause a lot of calf tension, knee problems, everything else. So now what we're going to do, and that one let go pretty quick, which is awesome. Generally, they don't let go that quick. So we took the bolster out just to make sure that it feels good. There's just a little bit left. Not bad. Bam. We'll take that. We'll take that. So now what I'm going to do is I'm moving up to his glute. The outside looks pretty good. But what I'm going to do is just going to kind of feel around again. You just got to feel what is right in there. Okay. So where I'm at, I'm going to come over to the chart. So let me kind of show you what I've done. We went from calf muscle up here, and I followed it down into there. Then I went down and did the deep calf muscles to help prevent any plantar fasciitis. Okay, I rolled the foot out and got to the outside calf as well. And then what I'm doing is I came up into here, all right? So this is the short head and the long head of the biceps femoris. That's where a lot of calf tension comes from. That one let go, all right? In the video I didn't show you, but then I would come to the inside and loosen up the inside muscles. And now what I'm feeling for is I'm feeling for all of these deep ones right in through here, because that's where all the hamstrings attach to over, and then the glute muscles go over the top, the deep hip rotators. So what I found on him is that the top part right here, all right, where the gluteus minimus and the gluteus medius connect right there at the top of the hip, he's got a big knot right in there. I also felt one right in through here, but they're the same thing. So my question is, if I release this one, then I'm going to come check up here. But there's a good chance that if I release this knot, this one will release on its own. So that's where I'm at. So I'm doing this right here, and I'm going to explain what I'm doing to him as I'm back in through here. So I'm going to be like, okay, what I've got here, Chad, this is your gluteus minimus and gluteus medius, and it's sitting right on the top of the hip bone. So I've got that 45. Just moving that around. There we go. Okay, see how it doesn't, can you feel how that leg just doesn't want to move at all? And it's okay to come out and shift, okay? Like there's times I'm like, so what I'm doing is I'm working on that glute muscle. I'm actually feeling that the knot is more up in here. So I come out and I'm going to push, and that is where the knot is. See? Okay? Let me just show you guys. I was here and I moved up maybe a ½ inch, and he went from, okay, yeah, I can feel it, it's not too bad, coming out, resetting, going back down on it to where he's like, oh, yeah, that's it. Like his whole body jerked. And I only went maybe a ½ inch. There it is. There it is. Breathe, breathe. And the thing is, he didn't even know this was even a problem. There we go. So yeah, so now what we're just going to do, now that I've really found what's going on, there we go. There we go. Gotcha. Ha ha ha. There we go. So there we just got it to release. Now he's got more range of motion. Just like that. Okay, so what I did on that is the knot, so I was pushing on it like this and moving it, where I felt the knot was right in here, or where the big bulge was right here. Once I pushed there and I was moving it, that kind of dissolved to where then I could feel, so I was pushing on the bulge on this one, but I could actually feel the knot with these two. So all I did was I lifted up, shifted it over, and pushed again. That's all. And it went from movement, like, oh yeah, that hurts and it won't move, to, oh, holy cow, I got to breathe deep. Okay, it was just a ½ inch. And a lot of times, if you're missing it, guys, you're only missing it by ½ inch. Remember what we talked about in our seminars, is if there's a knot right here, there's one, if you can't quite get it, go up an inch, down an inch, right an inch, or left an inch of it. And that's when you're going to have where the problem is, because sometimes the knot and the big bulge that you're feeling is not actually where the actual problem or that knot is. That once it releases, everything else lets go. So now what I'm going to do is, because the knot was here, and I felt another knot there, and it's just not there anymore. So now what we've got is very good range of motion. Lots of hip stuff going on, lots of movement, and just, you can totally see. Now, we're not going to do it in this video. I just want you guys to recognize that we worked on the calf, the hamstring, and the glute. Now, I'm looking at the opposite side of him. This hip, this glute is raised, and then I would go over and work on this one if there was time. Now, if there wasn't time, I would educate them, be like, okay, here we go. You had some really good, and this is how I would talk to my clients, okay? So I'm going to give it to you. Holy cow. All right, Chad, so we got a lot of calf stuff, and I would get them up and talk to them. So we had calf stuff. We got that loosed. What I did was I actually checked out to make sure that there was no muscles below to add to plantar fasciitis. We came up the hamstring to make sure there wasn't anything there, and obviously you felt some huge stuff there, and they'll be like, oh yeah, that was painful. And then we made sure that we checked the glute out and got that done. He goes, yeah. I go, okay, so what I've noticed is you still got some stuff on the left side. The glute and the calf are really tight. Our session's over. Sorry I didn't have time to get to all of that, but what we got to today was really, really good. So let's get you back in the next 7 to 10 days. I've got some openings next week. Let's go figure out what your schedule is. Let's get you back in here. I want to check what we worked on today and then make sure that nothing shifted, and to see where your body has shifted with the glutes, the hamstrings, the calves on the left side. Plus, I also want to check out what we started with on that knee and quad in the first place. How does that sound, Chad? Does that sound educated, communicated, and I got them rescheduled? All right? Yeah, is the money important to get them rescheduled? Yeah, but guess what? I want to make sure that his body is in almost perfect alignment. You're never going to get him into perfect alignment because they live life. But you got to get them out of pain enough that they're going to be like, holy cow, this person, this therapist knows what they're talking about. They know their anatomy. They are passionate about me and what my body needs, and I didn't even know I needed it. Of course I'm going to come back. All right? And then they're going to tell other people about it. And that's the key. So like I said, that's what we do is I'd have them stand up, walk around. How does that feel? Hey, sorry we didn't get to the glute. Or I would even, on the table, I would even be like, okay, we got about 10 minutes. So what I'm going to do is I see that your hip is tight and we got to work on that. And then if we can get this really quick, I'll go down and get the calf muscle. And if we can't, we're going to need to reschedule and come back. Sometimes I already have them rescheduled while they're laying on the table. So as soon as they stand up, I don't have to go through that spiel. I just say, hey, you know what? Let's go out and get you rescheduled. They go, okay. Educate them, communicate. You're almost an edutainer is the word that I'm going to use. Is you got to educate and you got to entertain them. But you got to communicate with them. All right? That's what we need. That's what you guys are going to do. The body's fantastic. All right? Learn from this. Rewind it. I really want you to rewind and see some of how these muscles were jumping because they were really jumping today. We're having a good one. Learn this, study this. Can't wait to see you guys next time. All right, to your success and health. Talk to you later.